Welcome to the Banega Swasth India podcast. Our focus is on creating a holistic and healthy India for each and every one. Our goal is one world hygiene, where citizens, individuals, society and governments work together to ensure health for all and foster global unity for a healthier tomorrow. India faces a renewed challenge in its battle against COVID-19 with the detection of the JN.1 subvariant in 11 states and union territories. Karnataka has reported a maximum number of cases, followed by Kerala, Goa, Gujarat, Maharashtra, Tamil Nadu, Delhi, Rajasthan, Telangana, Odisha, and Haryana. The World Health Organization, which is WHO, has classified JN.1 as a separate variant of interest after the subvariant was detected in 38 countries apart from India. The JN.1 variant is an evolution of the Omicron strain, which dominated the COVID landscape in late 2021 and early 2022. The pressing question on everyone's mind is the efficacy of current preventive measures. What precautions one should take? Are masks really effective in cutting down the transmission? Is it a deadly virus and should we be worried? How is the JN.1 subvariant different from the other COVID variants in the past? What are the symptoms and is a booster dose of the vaccine needed? My name is Ambika Singh Kama, and on the Banega Swasth India podcast, we have with us Dr. Vivek Anand Padegal, Senior Consultant Pulmonology, Fortis Hospital, Bengaluru, Karnataka, who will answer all these questions and more. Thank you so much, Dr. Padegal, for joining us. Could you tell us how worrying is the JN.1 subvariant trend, given that India and worldwide COVID-19 cases are seeing a surge in infections yet again?
Well, after a long time, we are seeing a more infectious, more aggressively infectious virus. That means it's easily transmittable and it has a new structure on spike protein. Spike protein is the protein that coronavirus attaches itself to the human cells. And that is also what is targeted for immunity by vaccines and so on. And it's completely novel. So if the body does see this virus, it may not recognize it and mount an immune response. And it seems to be rapidly increasing in infection rates across the world. It was first identified in September and is now expected to be probably the number one cause of COVID infections in North America and Europe. So it's just eventual that whatever is in other countries comes to India. So it's important that we recognize it, okay? And it's important that we take some basic precautions. Now, the virus itself does not seem to be as dangerous as we saw in the first and second waves with the Delta variants and the Alpha variants. Most of the reports are mild disease, little bit of body pain, sore throat, cough, that sort of thing. We're not seeing a lot of reports of pneumonia, but for the most part, and what we're seeing currently, most COVID is very mild and goes away quite easily. So, is there a cause concern? I think if you have comorbidities such as diabetes, bad lungs, heart disease, you're a cancer patient, take precautions. Avoid crowds. If you have to go in a more crowded or poorly ventilated area, wear a mask. And take common sense precautions such as washing your hands and good sanitary practices.
Dr. Padegal, if you can explain this variant of COVID, its symptoms, and how is this different from the previous variants?
Compared to the variants in the past, this is an Omicron strain. So this has been the predominant strain since probably January, December of 2021, January 2022. The third wave was Omicron. At that time, the majority of Omicron was XBB. And corona is a virus which mutates. That means its genetic makeup changes very, very often and quite quickly. So that's why you see these frequent changes and the new strains of COVID. And so over the time, it has gradually changed. It changes its protein coating, which is what the body recognizes when you have an immune reaction. Okay, so that's why we're having all of these issues. This time around, and most of Omicron, it is basically upper airway symptoms. That is cough, runny nose, a little bit of body pain, a little bit of fever. Those are the major ones. You could get some nausea, vomiting, or diarrhea. That is less apparently with this strain. And we're not seeing a lot of COVID pneumonia. Uh, COVID pneumonia can happen, particularly if you are immunocompromised. So, say you're on cancer, a patient on immunotherapy or chemotherapy, or somebody with bad lungs or heart could potentially develop COVID pneumonia, but it's nothing like it was in the second wave or the first wave. We're just seeing very sporadic cases. And even abroad, where these patients are being reported, there's not a lot of reports of pneumonia, which is probably the most important thing that we need to be really worried about.
So you are saying that this variant of COVID is not as deadly as compared to the other variants in the past?
Yeah, compared to the Delta variant, that's right.
Well, this is indeed a relief, Dr. Pedicle. What are the precautions that need to be taken to deal with this strain of COVID virus?
Precautions to be taken for this strain of virus are probably more common sense. We've been doing this for the last 3.5 years. We all know what to do. Hand washing is very important. Um, so frequently wash your hands. Make sure if you touch your nose or mouth and you're sick, wash your hands. Particularly if you're sick, please don't go to work. Don't go to school until you're better. Wear a mask. And if your symptoms are not better after a few days, get tested. Um, that is more of a precaution so that you don't give it to other people. That's very important. Now, if you've got persistent illness, go get tested for COVID. See the appropriate medical person that you need to see. And most of the time, just symptomatic treatment, paracetamol, antihistamines, cough syrup was enough. Um, Other precautions are if you do particularly have health issues, probably for the next month, not just COVID, we're seeing a lot of influenza, we're seeing a lot of other viral infections. Probably avoid crowded places like theaters or markets. Avoid poorly ventilated areas, especially if you do have other problems with your body. If you absolutely have to go, wear a mask, particularly an N95 mask.
Banega Swasth India podcast will be back after a short break.
Watch out for our new Banega Swasth India video podcast, Swasthya Mantra, the first ever public health and hygiene podcast. The podcast is live on Spotify, Apple, and YouTube in English and in Hindi.
Welcome back to Banega Swasth India podcast. Dr. Padegal, how effective are masks against this variant of coronavirus? What kind of masks one should be wearing? Any tips you would like to recommend?
Masks are generally very effective for any viral illness. It does cut down transmission. So for one person to give it another, if one person who's sick, especially, is wearing the mask, it does decrease. Both are wearing a mask, it decreases it further. Um, the government of Karnataka has just issued orders saying that people over the age of 60 and people with health conditions should wear a mask. So definitely it is effective in decreasing the transmission. Okay. I would prefer an N95 mask because that has the most smallest pores and it decreases the transmission the best among all of them. But at the end of the day, a surgical mask would be the second best. I would avoid cloth masks because they don't really work that well.
So, according to you, N95 masks are really effective in cutting down the transmission. Dr. Padegal, moving to COVID vaccines, how effective are coronavirus vaccines in fighting this new strain of the virus?
Currently, the availability of vaccines in India for COVID are very limited. They're simply not very easily available. And most of the vaccines that we have are for the Delta variant. We don't have any updated vaccines at this current point to protect. Some of the whole virus vaccines, such as Covaxin, perhaps could give some protection. But then, like I said, the problem right now is availability. We don't really have easy access to vaccines right now in India. I believe the government is working on it. Uh, and if you are able to get a vaccine, a booster may not be a bad idea at this point.
Will India see COVID surge once again that can lead to imposition of restrictions in the coming months? And lastly, will masks make a comeback?
I certainly hope not. We're all hoping and praying that we don't have another surge. I mean, if we do have a surge, hopefully it's just a mild spread of the disease where people get a cough and cold and some body pain and get better in 2 or 3 days. Um, we all definitely do not want to go through what we went through the first and second, and to an extent, the third wave. Um, but I think some common sense precautions, while this thing spreads, to slow it down would be definitely help. Like I mentioned, masking is a good idea, especially if you're at a high risk. That means older people, okay, 60 plus, people with heart, lung disease, people with diabetes, people with organ transplant, people with cancer. These type of people should probably be more aware and wear masks in high risk situations. They don't need to wear a mask at home, obviously. And if you're sick, please don't go to work. Please don't go to school until you're feeling better, because what you have could be COVID or any other viral infections which will be transmitted to other people. And if you're around other people, wear a mask, because that decreases your infectivity to other people. And practice proper hand hygiene. Wash your hands, especially if you touch your nose or your mouth. Use your elbow when you're sneezing or coughing. Better to wear a mask again. These are very common sense things. If you're in a plane or a theater or a market, maybe better to wear a mask as well. Masks, again, like we talked about, the best masks are N95 masks. They tend to have the less penetration of viruses. A surgical mask is probably the next best. And remember, no, these masks don't last forever. You can wear it for a limited time period, but then it needs to be replaced. You can't use it for months at a time. These are essentially disposable masks.
So we can say, unlike its predecessors, the JN.1 strain of coronavirus primarily shows upper respiratory symptoms such as cough, runny nose, and fever. However, while the risk of severe illness remains lower than previous variants, individuals with comorbidities and the elderly remain vulnerable. Thank you so much, Dr. Padegal, for providing a detailed insight. Well, that's it on the Banega Swasth India podcast this week. If you have comments, queries, or suggestions on the topic we discussed today, or issues you would want us to cover in future, do write to us on bsipodcast@ndtv.com. Remember, BSI stands for Banega Swasth India. You can also connect with us on Banega Swasth India handles on Facebook, Twitter, and Instagram, and continue with the conversations through the week. Till next week, this is Ambika Singh Kama signing off. Stay healthy and stay safe.